BU Today thought it would be interesting for us to have a discussion about a recent article that came out in Nature magazine, or a commentary by a number of distinguished scientists and I guess lawyers and public health professionals discussing the responsible use of cognitive enhancing drugs by the healthy, and seeming to advocate it. And so that's the basis of the discussion today. And George, do you have anything that you'd like to open up with in terms of some thoughts about this article?
Well, I think that it's a very provocative article, and I guess I'd give the authors credit for raising this issue as a very serious issue, which it is. And it has to do primarily with whether we want to change the historic view of medicine, which is to help heal people with illness or disease, try to make people who have abnormalities normal, or whether we want to add to that, taking normal, healthy people and trying to make them, as the authors say, better, trying to enhance them. And that obviously raises the question of what enhancement is and what the risks and benefits of that are, and whether this is medicine or not, and who should be in charge, and all those fun things that we should definitely be talking about.
Right, and from my perspective, not being an ethicist, but of course we in pharmacology think quite a bit about the ethical use of pharmaceuticals. That's a very important part of what we think about and what we teach our students about. And it is a question, a novel question, to be thinking about the discovery and development of pharmaceuticals for the healthy. Our mission is to understand and discover and develop pharmaceuticals for the treatment of diseases and various disorders, including neuropsychiatric disorders. And so that's really our mission and our primary mission. Naturally, there are areas of pharmacology which do deal with normal health, such as the use of nutritional supplements like vitamins are clearly very important and are a large part of an aspect of pharmacology. So any substance, when taken, when administered to an individual, whether it's by an oral route of administration, such as in a pill, or perhaps as a supplement within foodstuffs, is within the realm of pharmacology. So this is some novel thinking involved here, and it's not diminished at all by the idea that a drug might be very well tolerated in individuals with a disorder. It doesn't necessarily mean that one can generalize from that to the idea that now it can be administered to large segments of the population willy-nilly, just perhaps because folks want to be a little smarter, with big quotation marks around that. What do you think about that?
Well, I think that's basically right, that we want to think about, with diseases, we have a long history of saying we want to do a risk-benefit analysis. We want to make sure it's safe. I mean, safe always begs the question, safe for what and compared to what? And usually it's compared to your disease. Especially to use an extreme example, if you have cancer and you're terminally ill, you're willing to accept a lot of risks for surgery, radiation, or drugs to try to cure that cancer. Now, if you're healthy, you would be out of your mind, and the doctors would be out of their mind to use any of these procedures that would be used in someone with a serious disease. For normal, healthy people to be taking drugs to, quote, enhance themselves or become smarter or better or do better on exams, I think the authors argue this too, I think you'd want to be sure that there were no risks, because you could otherwise you'd be taking a healthy person and making them sick, and that's just the opposite of what medicine and drugs should be doing.
Yeah, exactly, and I think that's a really a key point. And I didn't get the sense that the authors of this article were treating that important point in a balanced way. They raise it, but for my own taste as a scientist, there was perhaps a little bit too much advocacy in this article. For example, a pitfall would be, as you point out, if an individual has a disorder. For example, in this case, ADHD is mentioned as a major one, and they refer to statistics indicating that perhaps as many as 5 to 10% of the youthful population are being diagnosed with characteristics consistent with ADHD by current standards, and that could shift with time. It's questionable whether the net is maybe too broad right now. This has resulted in the dissemination of a large amount of therapeutic into the population for chronic use. The main one that people are familiar with is Ritalin, and this is an amphetamine derivative. It's a mild stimulant, but nevertheless a stimulant. It increases catecholamines in the central nervous system, such as norepinephrine and dopamine. Now, if you have a deficiency, let's keep in mind that it is very difficult, very, very difficult to demonstrate what the etiology, what the cause of a neuropsychiatric disorder is. For that matter, most disorders do not have their biological mechanism very clearly and rigorously established. So with most of this, we're kind of probing around in the dark with things that provide symptomatic relief, but we're not really sure exactly what the cause of the disorder is. So now, but let's make the simple assumption that yes, it is that there's a deficiency of catecholamines in kids with ADHD, and now we use a medication that increases catecholamines, and then symptomatically the kids perform well and they have a good life, whereas otherwise they wouldn't. Well, there's a justification for the ethical use of the pharmaceutical in that case, because for those children, even chronically. But now a normal person might actually, over a period of 20 years or 30 years or 40 years, develop some very serious clinical problems that are not foreseen, even though the person with the disorder might not, because they have a deficiency. So the baseline has to be considered, and particularly when there's a long-term chronic use involved, as compared with, let's say, a short-term, intermittent, I'd like to take a pill the night before a test kind of a scenario.
No, I think that's right. I think we want to look at things that are temporary, one time, two times, and don't have any permanent effects versus things that could permanently alter functioning.
Right.
Much more important issue, yes.
And and the other concern that I have about this is, and I think the authors have appropriately sort of covered this base by referring to the phrase of evidence-based medicine. So on the one hand, the article seems to me to be advocating allowing the widespread use, or almost ad libitum, of cognitive enhancers. Although they don't specifically come out and say, I think, that these kinds of drugs should be over the counter. I think they're talking about still prescription use, but making it an on-label prescription use rather than an off-label use. Is that your impression also?
They seem to be, but they don't really come out and say it. You're absolutely right, and that's a critical issue, whether they want off-label prescription drugs prescribed for test taking, for example, or whether, as they say in their first sentence, they just want it not to be a crime for students to share drugs with each other.
Yeah, I found that to be kind of perplexing as
Yes.
I read through the article. It was almost like it was written by different people. Maybe
it was. Maybe they divided it up. I don't know.
I don't know, but it didn't seem like there was a consistent, real philosophy within there, and I found myself cringing at times as I read it and read some of the arguments. And one of the statements that I found particularly objectionable had to do with what they refer to as coercion, and that is that the idea is that, well, if Johnny is getting Ritalin or modafinil, Johnny's parents are buying that for him, and now Jane's dad learns about this, but Jane's dad can't afford to buy it. Right? So what happens in the schools? and they raised it, and you know, it's like, well, everybody should have a laptop computer, right, if they're going to compete on exams and things like that. And they equate these drugs with laptop computers and certain other things, which I didn't see that that was a reasonable equality to make. And then they even suggest that, well, maybe schools should provide these medicinals to the kids. So I thought that was a bit over the, not a bit, but pretty far over the top, and really doubt that that would ever happen in this country. I don't even know if it's, maybe it's worth thinking about to challenge our imagination, but it would be really hard for me to support something like that. Did you get the same feeling or a different feeling about that statement?
Well, yes, I agree with that. Also, they keep using different analogies, and they're really making 2 points. One, they're trying to make the point that this is just there's nothing really significantly different about this than anything we do now, whether it's laptop computers, caffeine, or just education, and they even talk about sleep and nutrition as all
Yeah,
being in the same category. The other point they're making is this is so different and so wonderful that everybody should get involved in it right away.
right,
So you know, they kind of want it both ways. They wanted to say, don't worry about this. It's like everything else we've always done. But on the other hand, this is so great that we should encourage it, a lot of people to use it right away. And
right.
and I guess my main issue would be if they're going to take evidence based seriously, they got to stop with the anecdotes and do some randomized clinical trials. And that you got to figure out how do you do that randomized clinical trial? You take half the students in a class and have them take a drug, and the other half not, and then see how they do on the exam. I mean, you have to have a baseline for the midterm maybe, and do that
Right.
on the final. But it would be kind of an interesting thing, even as a thought experiment, to see how you'd get informed consent to do that study and see how the students, whether the students would think it's a good idea or a bad idea to volunteer for that study.
Right. Well, George, you and I are professors, and we know very well that if all of our students were taking cognitive enhancers and all of a sudden they were acing these exams, which would be very unlikely because
Unlikely, I think that's
right,
right.
because these are just mild enhancers in normals. But we just make the tests harder.
Well, well, exactly. If everybody takes it, it just raises the baseline. You're absolutely right. It doesn't give you any competitive advantage, which is the only reason you're taking it in the first place, it seems to me.
Sure. I mean, we know that very well from social stratifications of performance on tests, which we have a long history of exploring in academics. We make accommodations for kids with or young adults with learning
Absolutely.
disabilities, right? And so if someone has a documented learning disability for whatever reason, whether it's reading or listening or diminished eyesight or upper right hemisphere learning upper, various kinds of learning disabilities that can be unobservable in normal life, but definitely, but documented to be there. I mean, college students can get an extra, double the time in taking a test. So if I would hesitate to, all of a sudden say that, well, because time is a limiting factor on taking these examinations, that college students now, maybe high school students, and my gosh, who knows, where this is going to go. Where could this go if we open the door to this? I mean, does little Johnny start getting Ritalin at age 4 because some parents start planning for college when the kids are born.
Yes, they do.
In some cities like New York City, where I used to live, I mean, the child is born and they start to bring in a consultant to prepare them for the entry into private school to get into college. So it is kind of a. I do worry about it. It's not like the farm isn't on fire,
No.
but I do worry about opening this door to, particularly in children, and and also from a pharmacological perspective, a straight ahead scientific perspective, if we go from short term to chronic use, I do worry that the real experiment is carried out when the drug gets into the open marketplace,
Hmm.
because that no pharmaceutical company and no government can or will pay the bill to carry out large scale clinical trials. really large-scale clinical trials. I mean, in this article, they cite a clinical trial that involved 30 patients, and that was the total size. So that probably means 30 normals. That was probably, I didn't read the trial, but, maybe 4 groups, and so, they're going to have 5 or 10 people per group, maybe at most 15 if it's 2 groups. That's very different from, for example, diethylstilbestrol, which we're familiar with caused great harm in between the 1940s and 1970s, and there were about 10 million folks exposed to that, of which many were women, and we're still studying the third generation impact of exposure of that drug, which was used off-label and thought to be safe in women who were trying to have children and were not able to go full term. So there is real concern that I have about these drugs in terms of long-term use, particularly when they're started early on in life.
Well, I think that's right, and I just highlight, and the authors do too, but then they glance over it, the issue of children and military, where the children have really no choice. Their parents are making the choice and the decision for them. So if there are any risks, the parents are exposing them to them. My guess is no parent would expose their child to this if they thought there were any risks. So we'd like more data, I think, before we did this a lot with children, although with Ritalin we are doing it a lot with children. And then the military. The authors say that you have to do whatever you're ordered to do in the military. That's not quite true. You mostly volunteer for things that are risky, but there's no problem with volunteers in the military. That's the real problem. They'll volunteer for mostly any of this stuff if it is suggested to them in the right way. So that's a problem. I think that is a problem, and especially in the military, which they don't talk about, where the guys are trained to kill. You don't want something that makes it a lot easier for them to do that, it seems to me.
Right. Yeah. And so then the question comes out about that I also am concerned about with these particular compounds, that they've been in use now for, 30 to 40 years, I guess. Okay. Ritalin has been around for that. So there's a fairly large population of adults at this point, middle-aged adults, who were taking it since they were children. And at the time that the doctors started prescribing it, it of course wasn't known that there were effects on reduced growth. So there had been adverse effects. I mean, there is an incidence of stunted growth when the drug is administered chronically and from early childhood. Nevertheless, so at this point, parents and the child would have to make a decision. Do you want to be this way or that way? I mean, can you go through life with ADHD, or is it better to be more normal and have reduced growth in some ways? But let's just say, for the sake of argument, that now we know that this population, and I don't want to scare anybody who might be watching this, who has been taking the drug for a long period of time, it was almost certainly a good decision because of the alternatives, which is why I feel good about drugs that ameliorate or reduce the symptoms of disease. Sure. And give people a better life. So that's the good part of the pharmacology. But it comes with risks. It's something that's not a natural substance in food, and we haven't evolved to deal with it, and it comes with risks, and some of those risks are long-term. So what's going to happen when that cohort of adults, now middle-aged adults, reach 65, where the incidence of Parkinson's disease starts to raise its unpleasant hit? Will there be an enhancement of Parkinson's disease? I mean, you could say maybe there'll be a reduction of Parkinson's disease, and it's the miracle drug. But my point is simply that something that would be go from the realm of, let's say, short-term taking a pill for a test to, let's enhance society. We're going to make it a better world because we're all, most of us are going to be taking this like vitamins. Raises the specter of a large number of disorders that we can't predict, and it's not clear to me that that's been thought out. I mean, and I don't want to be too hard on these authors because they do call for a discussion.
Exactly. Yeah.
Thought, and that those are the types of things that come up in those discussions.
No, absolutely. I think that's correct, and that to the point where they say they want more evidence. Who could disagree with them? We need a lot more evidence before we encourage, I think, people who are healthy to think that this is going to make them, quote, better human beings. And then if everybody takes it, we're going to have a better society. I think that's going way overboard. I think that's
Right.
highly unlikely. I'd like
Yes.
that. I'd like that with them. I don't think everybody is real smart right now, and I don't think we have a very good society. But I'm not sure drugging everybody is going to make it better.
No, and maybe the other question that as a society we have to ask ourselves is, would it change the spectrum of personality types? For example, the person that you fall in love with and marry has a certain set of characteristics. And, there are very, very smart, hyperactive people who are not impaired at all, but they're very, very smart. And then there are other people who aren't quite as smart however we characterize smartness.
Mm-hmm.
I mean, that's another question. What do these compounds really do? Are they just increasing? We know that they increase focus and attention, and just by being able to concentrate a little better, people will do better on objective tests. But are they really making them more intelligent, or are they just increasing performance on a test? If you're not making people more intelligent, if they're not becoming more scholarly, I really question the benefit to do better on a test. To me, is not an objective of college education or high school education. The objective is to learn material. The test is really, at that point, a motivational device more.
Exactly.
Yeah.
So no, that's exactly correct. Yeah. The other kind of scary example they use is the surgeon. They come back to the surgeon a couple of times, and they say, if you have a good surgeon and you put him on these drugs, he may be able to do more operations. He may, but I don't want him operated on me. I can tell you. His hands might start shaking too after 24
hours. Yeah, that's right. Yeah, my surgeon, I want him going to sleep early, exactly. And I want to be the first patient on the table.
That's exactly right. The first one in the morning. You're absolutely right. Yes.
Having worked in a medical school for many, many years, I know the time of year and time of day I want. Yeah, I certainly don't want him staying up for that 44th operation on that day.
I don't think so. I mean, again, I think you can make some arguments for some missions in the military, but I don't think you can make any arguments that are related to patient safety or good medical care for keeping doctors awake longer on drugs.
Yeah, I thought that one was amusing too. And I don't know, do you have any other issues that you wanted to talk about? I know there must be 100 others, but right at the moment I think I probably need a little cognitive enhancer to
That's right.
get me to remember some of them.
To go get another cup of coffee here. No, I think we did. I mean, the point of the article, I think, was to raise issues, and I think we've covered the majority of them right now, and let other people continue the discussion.